Thank you so much for joining us today on your Pelvic Health Podcast. I am Susan Winograd, the founder of Pelvic Floor Rehab, and I am thrilled to be your host. I'm so excited about today's episode. We are chatting with Chantal Traub today. Chantal is an active birth doula. She's a childbirth educator and a pre and postnatal yoga instructor. Chantal's passionate about helping parents prepare for a positive birth experience and a full recovery postpartum by educating on safe and effective pelvic health for birth and beyond. I personally became passionate about making sure Chantal got on this podcast because one of our amazing PTs took Chantal's course, Pushing for Power. And once we heard about the information that Chantal was teaching, I knew that this was a conversation that I wanted to have with her. Chantal, welcome. Thank you so much for being here today.
It's my pleasure, Susan. Thank you for the invitation. I'm looking forward to our conversation.
Me too. Chantal, I would love for you to tell our listeners a little bit about yourself and how you became passionate about pushing for power.
Yes, thank you. So I've been assisting expecting families here in the New York metro area since 2003. And as a birth doula. So I am an active birth doula. I'm a childbirth educator. I've been working, in preparing pregnant people with their bodies through yoga movement. For many years, I was teaching yoga since 1996. And I also, in later years, became a women's health coach. So as I was attending these births, I would often find that moms were pushing ineffectively. They would push for many hours, quite forcefully into their faces, creating broken blood vessels, broken capillaries, or pushing in their eyes and their face, and then also pushing really ineffectively into their abdomen, sometimes creating a diastasis, or if they had one, making it worse, or pushing forcefully down into the pelvic floor, sometimes sustaining unnecessary damage. And the more that I attended births, the more I would think about, like, why aren't we helping our moms push better? And at the same time, I had a women's yoga class that I was teaching. So it was a huge range of different ages and stages of women. And some of the older women in my class would share with me that they had some type of like leaking if they jumped or sneezed, some type of pelvic pain, or even a prolapse. And the more that we dug deeper into the stories, they inevitably went back to their births. And what I began to realize is that, as we age and our bodies change, then sometimes those birthing experiences may catch up with us. And I would bring this up with some of the OBs and midwives that I worked with. And I was like, okay, we have to prepare these moms better. And they'd be like, well, they only have to get it once. Somehow they'll figure it out on this day, on this night. And then the next time it's so much easier. And that may be true. Second, that vaginal births are that much easier, but not always. Sometimes these moms would push for hours and hours and hours, sometimes needing an episiotomy, a vacuum, forceps, or even a C-section. And these were kind of the stories that pushed me, if you will, to create my class, Pushing Power, because I wanted to empower moms, birthing people to advocate for themselves, to understand their bodies, to know how to coordinate their muscles so that they could push effectively and shorten that pushing stage and just minimize damage.
Chantal, you just said so many things that I would love to comment on because every single nugget was so important. As a pelvic health physical therapist, I see so many women that come to us approaching menopause or living in menopause. And I know that had they gotten the help they needed during pregnancy, after birth, that the issues that they are facing now could totally have been deflected. So I thank you for bringing that point to this conversation. I am always preaching it, but I think we need to be having this conversation more, that, we can help moms during pregnancy and after birth. And that not only helps them have a better birth experience and a better postpartum recovery, but also helps them throughout the rest of their lifespan. And I think that is such an underappreciated concept, that what we're doing for moms during pregnancy and after birth will most likely affect them through the rest of their seasons in life, right?
100%.
Right.
100%. And that's what I've tried to explain, like in the birth room. It's not just for now. No, if you just, fix it right now, that doesn't mean that's a done deal. No, this has a huge ripple effect. It
Yes.
affects our lifestyle. And, I think that a lot of folk don't think about it until there's something wrong. And then that's all you can think about. And I want them to enjoy their babies. I just enjoy their parenthood, their life. It's just,
Yeah.
it's huge. It's
Yes.
huge. And
Another
so I
another
think
really important point that you made that I would love to address, and I think that I am very passionate and emotional about this because, as a pelvic health PT, we see this all the time where other healthcare providers are just telling moms, you'll figure it out. It's okay. And subsequent vaginal births may or may not be easier. The problem is, I find that if that first birth does not go as smoothly as we hope, then mom has that birth story embedded and integrated in her mind. And I see so much fear when that happens going into another pregnancy or another labor. So yeah, it might be a different experience getting the baby out, but from an emotional, psychological, nervous system perspective, I think if things don't go smoothly the first time, when we could facilitate that, the ramifications are tremendous.
yes. And what I have found is you're absolutely on it. And so my other passion that I have incorporated into my classes is my deep dive into the last few years is on polyvagal principles that I bring into my coaching and into my birth work, is that the nervous system state does shape the story. And while we want everything ideally to go according to plans, sometimes the plans change. But if the birthing person is feeling safe and supported and connected throughout that experience and into early postpartum, it does shift the story so that then the healing can begin so much sooner. So ideally we want to, prevent. And then if life happens, we want to be able to catch that right away, to be able to support that person through that process to prevent that whole ripple effect that is what you're talking about.
Absolutely. I think the work that you're doing, the polyvagal work, is so incredibly necessary and beautiful, because if we can do that work with the nervous system before, you're right, we can have more resilience to process and meet our experience in a different way than if we don't do work with the nervous system and our foot is on the gas pedal all the time, and then we're really in not only fight flight but sometimes freeze mode. So I think it's so important. I'm passionate about mind and body, and I really don't believe there's any other way.
Mm-hmm.
So
Mm-hmm.
I think
I'm
that's,
on the same page as you.
yeah, we speak the same language. I love that.
Mm-hmm.
Chantal, why do you think women are so underprepared for the second phase of labor, the pushing part of labor? As I was thinking about this podcast and all of the amazing work you do, this question kept coming up in my head. This should be universal education for anybody that is going into a birthing room. Why do you think women are so underprepared and this work is not, everywhere? I don't
I
even know if
think
that's
the
a
thing,
question you can ask. I don't even know if it's rhetorical, but I would love to hear your thoughts on it.
I think while things are beginning to change, like like from people like myself shouting this from the rooftops, you're like there are people really passionate now beginning to come out. So I do think the conversation is beginning to change. When I first started teaching this class, it wasn't. This was people wait. Um, so I often think so it wasn't taught to me as a childbirth educator. I went through 2 childbirth educator trainings to be certified as a childbirth educator, and we were always taught like you'll know what to do when it's time to push. It's instinctive, and while I wish that for everyone attending birth, I know it doesn't always go that way, or it can take a while until you start feeling that connection, that coordination, and I think pelvic health isn't necessarily taught in obstetric school. Like they know how to, they know enough for surgeries and how to fix it. They don't understand the full extent of pelvic health. I just don't.
Yeah.
So it was right before the pandemic when I was invited to teach to some OB residents, and that unfortunately got shelved. Although I do have a lot of OBs and midwives that do come to my classes, and I think now there is more interest and there is passion. I mean, certainly here to understand that more, because the consumer drives it, and I think that pregnant people are asking more. So I think
I was just about to say that, Chantal. I think OBs and midwives are starting to become more interested because I think moms are such badass rock stars and they are advocating for themselves and they're doing their own research. I was shocked. I do a lot of work with midwives and doulas, and I actually treat a lot of midwives and doulas, and I was shocked at how there was a lack of knowledge and information that midwives had surrounding the pelvic floor. And I actually spoke at the annual conference for midwifery, and I've given I've done 3 online modules with Gold Online Education. It's an international platform. I did 3 online modules to educate midwives on pelvic health as it pertains to pregnancy and birth. And I think that they are so interested when they're exposed to the information. Their first reaction unanimously is, "Oh my goodness, how did I not know this?" I've given workshops at birthing centers all around South Florida, and once they're exposed and introduced to the information, they are, they're into it. They are drinking the Kool-Aid of helping these moms because ultimately that's why they went into the field. But yes, I'm hoping that through our work and through moms advocating for themselves, that the conversation does become more universal. Chantal, I am a very visual auditory learner, and I know this is a podcast, but is there any way that you can sort of verbally take us through the journey of what happens to the baby as it goes through the pelvis and the effects of that on the pelvic floor and maybe even the pelvic bones? Because I think that when moms
yeah.
understand what is going on, that it advocate for themselves even more and they can implement strategies better even more.
Yeah, 100%. I know this has been filmed, but I'll just demonstrate it because sometimes it just
Yeah, it's easier.
right. I kind of just I am such a visual learner as well, so I'll do this for you.
Yeah.
But as I speak, the learners will get an understanding. So, I always teach my clients about the pelvis and about the structure of the pelvis and the anatomy of the pelvis and the pelvic floor, and just understanding that, the 4 large bones that are joined together by soft tissues like the joints, the pubic symphysis and the sacroiliac joint, that little tiny joint right at the base of the coccyx, which has more or less ability for movement depending on many things. but well, let's focus more on the sacroiliac joints and the pubic symphysis. And these bones are allowed to like articulate and move with and against each other. And not so much during the life of a woman. We're talking about the female pelvis here. So the female pelvis, so if you have a uterus, so not that much movement during life, but there is movement during menstruation. So, you know, this movement is released by hormones, progesterone, relaxin, human gonadotropin, that allow for these subtle articulations and movements. But there's a lot more movement towards the end of the pregnancy. So I think that,
Right.
you know, many moms are aware of that, the kind of loosey-goosey kind of feeling, that sea-legged feeling right at the end of the pregnancy, but then a lot more during childbirth that facilitates these movements. And as childbirth educators and doulas, ideally we teach moms how to encourage their positionings and their movements to encourage the babe to come into the pelvis and navigate the pelvis and leave the pelvis. But for the purpose of today, we're going to focus on the bottom of the pelvis. So, you know, understanding that the deep muscles of the pelvic, well, let's start with the deep muscles of the pelvic floor attach. I'm going to say this, I know you understand, but for the listeners out there, the deep muscles of the pelvic floor attach kind of at the middle of the pubic symphysis, the ischial spines, and then around S3, S4 in the sacrum. And then the superficial muscles of the pelvic floor will attach kind of at the bottom, at the inside of the bottom of the pubis, the sit bones, and the insides of the sit bones, and the tailbone. And so getting a sense of, you know, here are the four bones, and the bony structure has this incredible job of not only protecting our lower internal organs, and then in the female pelvis, that will be the bladder, the uterus, and the rectum, which these organs are supported by and with each other and by the pelvic floor. So these bones are important because they also provide that protection, but also attachment points for the pelvic floor, which I just described where the attachment points are. And then the cool thing about the pelvis is it also connects our spine to our legs. And what we do with our spine and our femur bones are going to affect the shifts and changes with the pelvis. So how we move our spine and how we move our femur bones are going to affect how the bones of the pelvis can move. So, you know, while the baby's inside the uterus, it has a lot of room to move, right? So it's able to move. And towards the end of the pregnancy, well, generally around 32, 34 weeks, the baby comes down into a head down position. And ideally stay there. While it doesn't always, but generally the baby will come down and stay in a head down position because of gravity. The weight of the spine and the skull will bring the baby down into a head down position. And then the baby will move head down, but it will rotate from side to side. And ideally this baby is going to enter the pelvis with its spine on mom's left, looking out towards her right hip. And why we want to encourage that, and that's why our lifestyle and the way that we sit and move towards the end of the pregnancy really, really matters, because if the way that we move and position ourselves will affect the baby's positioning. But ideally, this baby is coming down with its spine on its left, because then it's following that natural curve of the uterus, which is slightly more curved on the left and angled more straight down on the right. And this is more important for first-time mamas because the uterus and those muscles are a little bit more stretched out a second time. So this is really important for the first time, even though as experienced doulas, we have a lot of, you know, tips and strategies to be able to encourage and support the baby to find an ideal position during labor. But I'm always encouraging my clients right at the end, you know, 37, 38, 39, 40 weeks to kind of support. We can't force the baby, but we can support the baby to come into this position. So assuming for today's conversation, this baby is coming down into the pelvis in an ideal position, and this pelvis is optimally shaped and sized because there are different shaped and sized pelvi. So again, as the baby towards the end of the pregnancy, ideally we'll also start just dipping into the brim of the pelvis. That would be a positive sign before we go into labor. And then contractions, those surges are going to help drive the baby down and through. So ideally, this baby has now dipped down into the pelvis, and then with contractions, it starts entering deeper into the pelvis. And as it enters a more narrow channel, that will lead to those baby's rotations. And as the baby comes down, it's going to come down and it's going to flex its head and turn, flex and turn and flex and turn. And as it comes down towards the ischial spines, which is kind of the middle of the pelvis and the most narrowest part of the pelvis, it's ideally going to begin to turn to fit through and also begin to turn to face its mom's back. Now, this is where the deep muscles of the pelvic floor attach. And so while a supple, balanced pelvic floor is going to help aid that baby to make that rotation where it will pass through and then come up against the pubic symphysis, flex in its head even more, while now it has the ability to move the sacrum and tailbone back if given that opportunity. This is really cool because while the baby is in a state of flexion, that if you think about the superficial muscles of the pelvic floor almost as a baseball diamond and then divided into maybe two triangles, you have that anterior triangle and that posterior triangle. As the baby flexes back, it's able to lengthen that posterior triangle, which is needed, because if that posterior triangle doesn't have that length, there's a lot of pressure anteriorly, almost too much. And so that's where we get those little anterior tears as the baby now, which has been in a state of flexion, needs to extend its head to come underneath this pubic symphysis. As it extends and comes underneath the pubic symphysis, it will slide across the perineum. And for a mom that does not have an epidural, she may feel a strong burning sensation. And that's going to be her clue to blow itty bitty birthday candles as the perineal tissues soften, thin, efface, and stretch around, release around the baby's head.
It's so magical.
Once amazing. It always blows my mind.
Yeah.
Once the head crowns and births, the shoulders that are wider from side to side need to turn on the perineum, and then one shoulder's born and the other shoulder's born, and then the rest of the baby will follow and slip out. There's more to it, certainly, that I cover in my classes, but that's just a general kind of idea of.
It's so fascinating, Chantal. How can we, two questions, how can we, number one, prepare the pelvic floor to help soften and lengthen and accommodate what that amazingly choreographed movement that the baby goes through to allow that process to happen? And do you teach moms to do different exercises or stretches during certain parts of pregnancy and during labor in order to facilitate the positions of the baby?
Mm-hmm. Yes, I do. But when I'm working with pregnant moms, I think, like, let's take it back to why is this important and why has it become so much more important, like into our today's world? Maybe, I mean, I'm not sure what was happening like maybe 100 years ago exactly, but I do know that our lifestyle has changed, and I actually really have seen it even more kind of over the pandemic, that we spend so much time sitting, so much time now, certainly with telehealth and Zoom meetings. These last few years, I've seen so much more tightness in the hips and the pelvic floor. And I think that our sitting culture doesn't help us prepare for birth. And so possibly pointing that out and making that aware of how we sit in matters. Often chairs and furniture aren't designed for functional sitting. So maybe to explore different ways to sit and spend and maybe break up the day. And we also, so this is even before the pandemic here in New York City, we as humans of our nature is often to create habits, but sometimes they're the same habits. So I would have many clients that would be, spin class 5 to 7 days a week, and that was their exercise. And so we lack in the variety of movement.
Yes.
So that repetitive movement isn't great in general for the pelvic floor and the suppleness and the mobility. But for birth, this is where it sometimes really shows up. So when we're preparing for birth, we have to kind of go back and look at how we spend in our days. What does our lifestyle look like? And we can start right there. I think just bringing awareness to it. Again, thinking about that nervous system. Where are we living? Where is our home away from home? Are we always in kind of like go, 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 and then we go so much, right? We all do it. Even like
Yes.
we were just
Yes.
talking about it.
Yes.
It's like then you collapse onto the couch and can't do another thing.
Yeah.
So how do we learn to understand that? Because when we're in that tense go, 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 it's tensing up everything on our pelvic floor. So learning how to kind of find those kind of vagal breaks throughout the day so that we're finding that relax and release in our whole nervous system and in our whole body.
And I think that so many points you said again are so important, and we definitely speak the same language, because I feel like I say this all day: variability in movement. When I was young, when I was younger, I felt like I needed to run 5 days a week. Like I needed to run 5 miles, then 6 miles, then 8 miles. And it was all about the running. And then I was doing yoga 5 days a week. And the more I learned and the more I matured as a PT, the more I learned that that's really not serving me physically or emotionally the best that it can. And my clients always say, well, what do you do for exercise? And I said, I wake up in the morning and I see what my body's calling for. So some days I run, some days I do yoga, some days I do Pilates, some days I just walk. So variability is so important. And I think that people like you and pelvic health PTs can help clients really navigate that well. And also what we do is we help people sort of fuse and connect movement with nervous system, either whether it's down training, or we really kind of target what we feel would be best for their nervous system and integrate that into movements or certain kinds of meditations. But I think you're so right. Not only do we sit so much, but we tend to do the same kind of exercise, and variability in movements and postures are so important. And, a couple of years ago, I was having a conversation with my mom about birthing, and my parents are European, and they said, your grandmother, there was no preparing for birth. They were working in the field all day. They were moving their bodies and squatting. And then when it was time for the baby to come, their bodies were ready.
Yes, you've said so many great nuggets right there. So yes, just going back, say to your parents even. So yes, so for example, like I think about, actually, I maybe not my parents, but I think about my husband's parents, because I think they're better examples, right? So here in the West, we have this obsession with exercise, but in Europe, not so much. So for example, I think about their mom, like they're very involved in just housework. I always tell my clients, don't be afraid of doing housework. Get down on the floor, scrub the floors. But maybe, running or walking to catch the bus. Then you take the bus to like the markets, and then you fill your bags with groceries. And then maybe you're walking up that hill carrying those 2 bags of groceries. And then, so you incorporate it into the day. And when you see that, it's like such like aha moments. And another point that you mentioned, because we both work with clients through the different phases and stages of life, and you don't really realize during the pregnancy and postpartum, but I see in my menopause client, it becomes so much clearer, because those repetitive movements that we just do are now going to catch up. And that's where the injuries happen. They're not seen it necessarily during pregnancy, but if we can instill those habits, oh my gosh, how incredible would that be for my postpartum, and many of my clients are going straight from postpartum into perimenopause because having
Yes.
babes later in
Yeah.
life. Um, so I think just understanding that for birth is going to set you up for success so much later in
Yeah.
life. And then you said something so beautiful, is that you said, when your patients ask you, what do you do for exercise? And you say, I wake up in the morning and ask my body what it needs. This is so important for preparing pregnant people for birth. What does your body need in this moment? So many of my clients are, okay, tell me what to do, how much, how many reps, what movement should I do? And
Chantal,
it's one,
don't you feel like, and I'm saying this as a first generation American, I feel my kids are going to make fun of me when they listen to this because I always say I'm first generation American, but exercise almost seems so contrived in our culture, right? You know, a generation ago, people like, you know, working in the field, like you said, exercise was so built into the day. And my style of PT is I really don't like to give my clients a certain number of reps. You know, clients want to know how many times a day, how many repetitions should I do? And it almost seems so contrived to me. I think that we need to, like you said, teach clients how to listen to the signals their bodies are giving them. I call them their internal check engine lights. Your body is helping you navigate life and communicating with you, and we need to learn how to listen to that.
yeah. So from a dysregulated nervous system, it's really hard to be able to go into the body and trust it. I think it's really important for many things. So about maybe teaching clients to become aware of what's happening in their body, and there's no, there's no right or wrong, because we're moving through it, all day, every day. But to be able to catch it, because so many of my clients, I think it comes from a place of, I'm going to say dysregulated, but you could call it anxious. When you're anxious, okay, just tell me how much, tell me how many repetitions. But if we can support our clients to maybe come down into more of a regulated space, then we can settle and really ask, okay, what feels right? In labor, it becomes really important, because we want to be able to bring them out of their heads and into their body, to be able to trust their body, to be able to move in a way that's going to support the baby's movement. So it's hard to be able to do that when you're really hypervigilant or dysregulated. And while birth is kind of sympathetic, you do need that energy to be able to move, but you want this beautiful fluffy cloud of ventral vagal kind of supporting that, so it's not too much.
Yeah.
And maybe some cues here or there to guide them, but keep asking, what do you need? What does your body need? And just invite them to ask themselves, what does your body need right now?
Be curious about it.
Yeah, be
Yeah.
curious. Begin to listen.
Yeah. How, as a doula, and I don't have the privilege of being in the room while moms are birthing. I wish I did, but it's such a privilege and honor. How do you help moms prepare to have the most meaningful birth experience? And I have had 4 births, and when I gave birth to my children, I did not have the knowledge that I had now. And I went into my birthing experience with the mindset of my doctor is in control. Like I did not feel like I was in control. My doctor told me when to push. My doctor told me when I was ready to push. I wish I had the knowledge that I have now. The only thing I could do now is help other moms get that knowledge. Thank God I had pretty easy labor and deliveries, but I wish I would have felt empowered. I wish I would have felt like I was in control and I pushed when I wanted to instead of being told when to push. How do you help moms prepare for that? Do you teach them how to have that conversation with their healthcare providers?
Mm-hmm. I do. I mean, so first of all, when you're choosing your provider, it's sometimes really hard. You pee in the stick, you find out you're pregnant, and you've got to go find your team. So ideally, you can, interview or get to know, or get a really solid referral. But I think finding someone that you like and trust on many different levels, professionally and emotionally, and your philosophies are aligned, but that you trust that person. It's really important. Those relationships are really important. And it is teamwork. I mean, ideally, and it's such a huge question, but ideally we come into this world where we're wired, that's our biological imperative need to connect. We come into this world to connect. And ideally, we come into this world into a regulated human mammal arms that are safe. And they co-regulate us to a time that we learn how to self-regulate. That would be ideal. Now, that doesn't always happen. Many of us don't get that. Some of us have to learn to self-regulate and have much more difficulty co-regulating. So one, it's understanding, but finding, say, your doctor or a midwife, a doula, yes or no, but finding your team that you trust, so that you're working together, they're working together with you. Even if your doctor guides you and gives you directions, if you trust that person, you can be more open and you can have these open conversations. And then the other thing is the way that I always start with my clients is, what do you want? What do you hope for?
Yeah.
Let's start there. What do you think the biggest challenges are going to be?
Yeah.
Help them set those expectations, because we want, when it comes to feeling safe in the world, we have to understand, like, what is the context of this in this moment? What are our choices in this moment? And how connected are we, say, to the people in the room, to ourselves, right? So in the birth room, let's take it there, whether it's a labor and delivery floor, at home, a birth center, what is that context and how are you feeling in that moment? So sometimes it's setting that expectation ahead of time, asking those questions. What is available to me going into this labor delivery in this city, in this state, at this time? What can I expect? So setting those expectations, first of all, asking those questions ahead of time, knowing that, yes, things may change, but if we understand, like, if everything's okay with me and the baby, then can I have intermittent monitoring? Can I move? What positions are you comfortable catching the baby in? Now, if things change, if, say, if something happens and I feel like, so your doctor says the baby needs to be born sooner than later, then I'm going to direct you and I'm going to need us to have a relationship of trust. Then it's going to change. It's going to change that narrative, that experience. And I always offer choices. Sometimes the choices won't be like a full range, but allowing my clients to have choices in a moment is going to give them.
I completely agree. Again, so many things you just said resonate with me so much. And I think what I got out of what you just said is that it starts with you. You have to know yourself. You have to feel empowered within yourself and your intuition and know that you can ask those questions and make those choices. And then it creates a growth of, you can choose other people that you trust, but it really starts with your own knowing yourself and your own empowerment. The other thing that you said that was so profound and important is choices. So many times when clients ask me for referrals or references, I always give them a few names and they say, well, which one do you think is better? And I say, they're all great, but it's about connection. You will know when you call that person whether you have that connection. I mean, you're a doula, I'm a PT, and I tell, my clients different strokes for different folks. We have, PTs in my own practice where one client may connect magnificently with one therapist and not so much with the other. And the client's always like, I don't want her to take it personally. And we always say this is a relationship, right? It's a therapeutic alliance. There has to be a connection. There has to be trust. So I always encourage people to call a few different people and see who you have the best connection with, whose ideas and philosophies, align with yours the best. So I think that's such amazing and important advice. And it seems like it should be intuitive, but I think that these things need to be said out loud and for people to really hear them so they can heed them. The other question that I'd love to touch upon, I feel like this is such an amazing and important conversation, are positions during birthing. So I'd love to know, are there certain positions that you teach moms for certain stages of labor while they're in phase 2 of labor? And are there any positions that you tell moms to avoid?
I always ask my moms, what position do you want to push in?
I love
Where do you
that.
want to start? The position that the mom feels most comfortable in is probably going to be the one that's most protective for her pelvic floor, because that's where she's going to be able to relax and release. We'll start there. If it's not working, for example, or, remember, this is really about the baby. Often it's the mom comes in and goes, will say to me, no matter what happens, I don't want to push on, I want to push on my left side, for example. And I'm like, okay, if everything's okay with you and everything's okay with your baby, then I will remind your providers of your preferences for sure. And just say we get into this position and baby's saying, hey, mom, you're pressing on my cord. I need you to move. Well, then the baby is going to drive the position. I can share a story. I will share a story, and then maybe we'll get an understanding. But I always start with my clients, what position do you want to push in? If you're making progress, we're seeing change, the baby's doing okay, we'll keep going. If not, I'll make a suggestion. But I do like to offer that choice. And sometimes moms are like, I don't know, just tell me, and then I'll make a suggestion. Of course, because I think, yes, ideally we learn to trust ourselves, but sometimes we take in our team, we want these resources, someone that gets us, that can make a suggestion in a way, but then be able to ask the questions if this is working or not working for them. So, for example, I'll share this example because I think this will be a good example, because I'd like to, I'll share some points that I think the listeners will understand.
Yes,
so,
please.
I had a client who, this client did not have an epidural, and if there's time, I can share another story with an epidural. But this is not about epidural or no epidurals. I'm just wanting to explain a story right here, so giving you details. And now it was time to push, and as we started pushing, she started in the typical kind of position that you see in hospitals, where you're like in kind of like a semi-seated position. And as she started pushing, the baby's heart rate went down, which is not uncommon when the baby's in the birth canal, for the baby's heart rate to go down a little bit. But then ideally, as that contraction releases, the baby's heart rate just comes back to its normal baseline. Now, this is obviously where we are trusting the providers. This is their call. This is why you choose a doctor or midwife that you trust, because we're always going to go, with their guidance here. But so while I was with my client, I noticed that the OB was, she was looking at the monitor. She was getting uncomfortable. I could see, I was reading her face, and I could see that she was not comfortable. And she turned to my client and said, this baby's not liking this, Tracy. I know that you don't want an episiotomy, but if this baby is not born in the next few pushes, I'm going to have to cut you. This baby really needs to be born. So my client threw me a very startled look. We had been working together for months. I knew that her pelvic floor was, incredibly well prepared, and she did not want an episiotomy. So I quickly said to her OB, who I had a relationship with, we'd worked together many times before, and I said, may I have the next couple of pushes with my client? So she said, yes, of course. How can I help? So I said to my client, can you just kind of roll over onto your side? Let's see if we can give this baby a break. And she was like, I can't move. So I said, okay, is it okay if I help you? And she said, okay. And her OB and I actually helped pick her up and over so that she kind of shimmied her over so she was on her side. And this gave her pelvis the opportunity to be able to allow the sacrum and tailbone to move back. So then I said to her, I'm going to lift this right leg up and over so that you just a little bit more towards your tummy to see if we can give a little bit more space to that baby. So on the next contraction, her baby rotated. It was so low down, you could actually see
Wow.
the top of the baby's head. On the next contraction, that baby rotated some more. On the next contraction, her baby crowned and birthed. And the rest of the body slipped out with an intact perineum.
Chantal, I'm like blown away. You can know the listeners can't see me, but I'm literally watching Chantal mouth open in awe.
No episiotomy, no vacuum, no forceps, intact perineum. So let me just explain a few things here. There's a few elements to focus on. First of all, the baby gives us cues, right? So if the baby and the labor give us cues, to an experienced birth support person, labor support person, we listen to these cues, we read these cues. So if the baby's not liking something, then we change position, see if we can help this baby maybe move or shift or float the cord, whatever it may be. Maybe this baby in this situation was needing to make that final turn before it could extend and slip underneath the pubic bone. So for this situation, coming into a left sideline lateral position was just really helped this baby kind of finish what it needed to do to be able to come under the pubic bone. Another couple of things. When a doula, so let's say there's an experienced doula in the room, is anchored in her ventral vagal, they can make quick and creative decisions based on experience, of course. So I'm going to just break it down. So I said to her, my client OB, may I have the next couple of pushes? I didn't say, can I have the next hour? I gave the OB context. May I have the next couple of pushes with my client? That made the OB go, okay, yeah, let's try. I said to my client, can you come onto your side? And she was like, I can't move, right? We're just, in that stuck molasses of dorsal, I can't move. So I said, can I help you? May I help you? So I gave her a choice. And I helped her move, because sometimes when we get into that kind of dorsal stuckness, we need to move to get a little bit into that sympathetic before we need that little bit of energy. So up and moving, helped her move. And it also helped the physiology of the mom's, body and for the baby to be able to complete its physiology. So there's kind of a lot, but it's really quite simple when you understand kind of the
Chantal,
the essential elements.
That's brilliant. Thank you for that. Thank you for that story. I think it will help people so much. And I think one of the most important parts of that story is how incredibly helpful a talented doula could be. I literally just treated a dad yesterday, and his wife just had a baby, and he said the birth went amazing because of the doula we had. She was phenomenal. She transformed the entire experience. One quick question before we go to takeaways, Chantal. What's your view on perineal massage at the end of pregnancy? I know some people are, more of a proponent for it than others. Do you teach moms to do perineal massage at the very end of their pregnancy to help prepare for birth if they want to?
So in my classes, I give the information. I don't. Okay, so let's go back to the research. So there's not that much, but what the research says is perineal massage, the last few weeks of pregnancy, may help in a primer, the first time mom, prevent a third or fourth degree. I'm hoping with my classes and everything that we give, that we are avoiding the third and fourth degree and kind of
Yes.
even minimizing a significant second. While a little skin graze, a small second, is absolutely in the range of normal. Yes, I'm almost like, let's go for that intact perineum, but I want the listeners to know that a little bit of that area heals so well. It's very vascular. It heals really, really well. We want to really minimize, significant damage. I'm always going for let's prepare the tissues, let's prepare everything so that we have an intact perineum, but a little bit of tear in a first degree, a small second degree, absolutely normal in a first time person. When it comes to, we have just a few minutes. I'll just share a story. So, I would share the information. I will give handouts if people want it. Because I think knowing how to and what kind of lube, or how to is really important as well. And also there are sometimes when it's not recommended. So, always check with your medical team.
Yes.
I did have a mom come to me and said, my husband wants to do the perineal massage, and it hurts and I don't like it. And I'm kind of cowering away from him. And I was like, oh my gosh, I don't want to set this up between a couple at all. So sometimes I don't want to give the message that, because it's sometimes hard to reach in yourself. So yes, if you want to try and you want to invite your partner, or you can get into a position that you can go for it, great. But if you're feeling that someone else needs to fix your body to prepare for labor, no, I'm not advocating for that. Or if it hurts and it's uncomfortable and you don't want to do it and you feel like you have to, no, I'm not advocating for that. There are other ways to prepare the muscles, to lengthen it, to release it, from exercises that all the physical therapists are giving your clients. First of all, I think learning how to know the difference about, drawing up and contracting the pelvic floor muscles, and then the difference between relaxing and releasing and lengthening is really important to know the difference.
Absolutely.
And yes, I do give some exercises for sure, but there's so much more. It's our lifestyle, it's our nutrition, it's what we eat, how hydrated we are, what kind of movements we're doing. So it's a very
100%.
holistic approach.
It's all the things. It's all the things. I couldn't agree with you more, Chantal. You're such a wealth of knowledge. Can you, before we sign off, give us a couple of takeaways that you want to leave our listeners with?
Yeah, I think, yes, absolutely. So many of my clients were like, I hear this all the time. The most frequently asked question that I get is, how do I get this baby out of me? And the biggest concern often is the fear of pain and the fear of tearing. So while I want to meet my clients where they're at and listen to what their concerns are and validate their concerns, I want to reframe the question that it's not so much about how do we get this baby out, but how do we release the baby out? How would you let the baby out? Getting the baby out is almost a practice of extraction and medical intervention. But if we kind of have the approach to letting the baby out, it's more of an act of welcoming. So we want to consider the baby's role in birth. How can we support the baby? What to help the baby to be able to give it the space that it needs? So if we bring our attention to, this is teamwork. It's connecting with your baby. You working with your baby together. And, again, epidural or no epidural, ideally, yes, we move in. in an intuitive way. But if we're tense and afraid, maybe we can't move and release, or if we have an epidural, we're blocked. So then we have to go, okay, where is the baby? Who are the experienced people in the room? The L&D nurses sometimes are really great with position changes.
They're
It can be
amazing.
really helpful. Yes, ask them, okay, can you make some suggestion for positions so that I can help keep my baby moving through the pelvis? Some OBs and midwives are incredible. So ask the team, how to help, support the baby. What other positions can I be changing? Even with an epidural, you can still be moving in different ways to support the pelvis. There's so many different ways with, peanut balls and tray tables and position changes. Of course, your team has to be with an epidural. With the position changes, you need to be able to weight bear safely. There have to be people supporting you in the room, but you can ask for help as long as the baby's doing okay to come into different positions to keep helping that baby move through the pelvis and out of the pelvis.
Absolutely.
So there's a lot you can do.
I think the bottom line is that every mom needs to take your course. That's just what I'm going to say. Chantal, please, I know people are going to want to find more of you. Where can they find you? And we'll have all the links in the show notes, but give us a brief idea of where you're at, and then we can give everybody the exact information.
So my website, my first and last name, which is chantaltraub.com. So that's a great way you can see all my classes and events. And there's a lot of free resources on my website as well. So you can learn more about me through going there. And then Instagram is a good place. I mean, there are other places as well, LinkedIn and Facebook, but those are a couple where people can go to find out more.
Chantal, thank you for being here. Thank you for your brilliance. Thank you for all of the work you do to give moms the most amazing and meaningful experiences for birth and beyond.
Thank you for having me. It's
Thank
been a
you.
pleasure.
Thank you,
Chatting with
Chantal.
you.
Yes. Thank you so much for joining us on this episode of Your Pelvic Health Podcast, where we give you the real lowdown on all pelvic health matters. Please don't forget to like, follow, and please give us a 5-star review so we can continue to bring you the information that you want to hear. And if you enjoyed this episode, please share and tag us. And always remember that healing requires a whole body approach, and you need to be your own best advocate.